Hi there, Dr. Hall. Looking at Chapter 33 from Tagher and Knapp, 2024 edition of Pediatric Nursing and Case Study. So let's talk about some genetic disorders in pediatrics here. Genetic disorders in pediatrics, we have looked at some of those, the Mendelian charts, in looking at genetics, and it depends on the parents for genetic disorders to be developed in children. General nursing interventions for genetic disorders, we're providing support to the parent and the child. We try to promote growth and development as best can be in spite of a genetic disorder, prevent and manage the complications, and promote nutrition. One of these disorders is called Fragile X syndrome. There's a picture of this in your textbook. Inherited genetic condition and most common cause of intellectual disability. So altered ability to think cognitively. Boys experience more severe symptoms than girls. It is X chromosome linked. What's it look like? Minor dysmorphic features, developmental delay, large head, long face, prominent ears, flat feet, enlarged testicles, hypermobile joints, meaning double jointed, that kind of thing, sensory processing troubles, and behavioral problems because the cerebral cortex has an alteration in inhibition. Diagnosis is confirmed with genetic testing. We treat with developmental therapies and intervention. There's no cure. Is the following statement true or false? Fragile X syndrome only manifests in people assigned male at false. Girls or boys can have it. It can also affect people assigned female. PKU, which is a genetic disorder. All babies are checked for PKU when they're born. It's an inborn error of metabolism detected through newborn screening. Follows an autosomal recessive inheritance pattern. Results from a deficiency of a liver enzyme. The body is unable to process phenylalanine. So irreversible brain damage from high levels of phenylalanine can occur. What happens with the baby? They're irritable, they're vomiting protein, musty body smell, increased reflex action, seizures, skin rashes, microencephaly, and developmental delays. Treatment, meal plans low in phenylalanine, low protein, and testing. Which of the following diets should a child with PKU adhere to? I think that's pretty easy. We just low protein. Trisomy 13, also called Pateau syndrome. It's non-inherited chromosomal condition. 3 copies of chromosome 13 are present in each cell. So you have to remember back to your pathophysiology course when you were looking at alleles, A-L-L-E-L-E, and we should have 2 chromosomes in each allele. So this is saying there were 3 on 13. What's it look like? Cleft lip, cleft palate, extra digits, clenched hands, closed set eyes, can have hernias, low set ears, scalp defect, single palmar increase. Look at your own hand and you'll see several. Limb abnormalities, microencephaly, and undescended testicles. What can we do? We can do prenatal testing. Most infants do not survive past the first month of life. What are the complications there? They stop breathing, apnea. They're deaf, have heart failure, seizures, intellectual disability, hemorrhagic abnormalities, and vision problems. And we have to just focus on the symptomatic care of the infant and support of the Trisomy 18 is Edwards syndrome. So what happens here? We have 3 copies of chromosome 18 in each cell. What's this look like? Intrauterine growth restriction, low birth weight, small head, small jaw, low set ears, short eyelid fissures, clenched and overlapping digits, hypotonia, short sternum, and narrow hips with limited abduction. Most infants with this condition do not survive past 1 year. Interventions are to repair or palliate the life-threatening abnormalities and focus on the symptoms for the infant, comfort, and support. Trisomy 21 is Down syndrome. Here we have 3 copies of chromosome 21 in each cell. What's it look like? Flattened bridge of the nose, almond-shaped eyes, cardiac defects, hearing and vision impairments, and increased mobility of the cervical spine. So you see that Down syndrome children don't have good fine motor sensation in their hands or their feet, and they walk kind of flat foot. We say like duck feet, flat foot while they're walking. We can test this prenatally by doing sampling. What do we do for it? We're going to support any complication that occurs, especially heart defects or GI abnormalities. Kids with Downs can be mainstreamed and can, go to Special Olympics and be champions. But they're getting routine testing, and you see some of that here: echocardiogram, abdominal ultrasounds, lab testing, sleep apnea, cervical x-rays, and thyroid hormone levels. Is the following statement true or false? There is a modified list of developmental milestones that should be implemented in the treatment of children with trisomy 21. Trisomy 21 is Down syndrome. True. The modified developmental milestone list should be utilized to assess for proper development. Turner syndrome affects only people assigned female at birth. What is it? What's it look like? It's a difficulty with nonverbal communication skills and executive function, wide or web-like neck, broad chest with widely spaced nipples, slow growth, short stature, cardiac defects, and edema of the hands and feet. Complications go with, hand in hand with those manifestations. We treat it with growth hormone and estrogen therapy. Klinefelter syndrome is a sex chromosomal aneuploidy in people assigned male at birth. Rarely recognized before puberty, and some are never diagnosed. What's it look like? May have hypogonadism, so smaller gonads, smaller testicles, learning disability, anxiety, immature personality. Assess and monitor testosterone, do some replacement therapy, may require speech therapy due to delayed language development. But again, remember, this one is not usually picked up until later.